Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Dear students, Assalamu alaikum. I hope you people are fine, and I am interacting with you people after quite a few time because of some personal commitments which I had been engaged with for the last 1 week. In this video, I would like to talk on the your OSPE examination, which is now about to finish, and the structure of the exam of the OSPE is basically divided into three main types of you can say knowledge assessment procedures. And as you know, that previously it was called talks, then OSCE, then OSPE, and what so and so on. But the main thing is that you move from station number one to station number two, then three, four, and so on. And for now, as for now, the according to the toss of the nuns, we usually have the option of 11 stations, out of which a couple of stations we have to make the couple of stations make them a rest station because of many reasons, but you have to uh, go through all the 11 station, and the three important things which you are expected at the OSPE exam. One, the most I would say in my experience with the students, the easiest one is an unobserved station. An unobserved station is the one in which there will be no examiner, there will be no patient, and uh, I will give you a few examples of the OSPE exam in the non-observed stations which can come into your exams and which we have been giving and which will be coming in your professional exams also. There can be a picture of any disease. For example, there could be a picture of dendritic ulcer and there could be some questions regarding it. There could be a picture of some red top bottles, that is mediatics. So you should know the indications or contraindications of the drug which you will have to write. Similarly, uh, a patient, you may see a patient there and a command will be written to uh, though it is unobserved, but he might be having, for example, lesion on his upper eyelid, and you will be asked to diagnose the patient in that particular area. It will be specified, but it is very rare. Mostly pictures and drops and instruments of the surgical instruments are placed and asked, and similarly short tonometer, which people must be knowing, may be placed, and applanation tonometer can be placed at the unobserved station. Pilocarpine drug can be placed, and this is one type of stations. The other is the observed stations, but these are non-interactive. That is, you will be asked to perform a specific task or a skill, and an examiner will be looking at your methodology. He will usually not interact with you or will not ask any question, and He will just observe you and he will have a key, and according to that key, the your marks will be marked. Example of these stations are, for example, there could be written that check the extraocular movements. He will just observe how you are examining, and there can be uh, some other command, check the MRD, and perform regurgitation test on the right eye of the patient. And there can be a further step, write down the positive finding. That is, if the regurgitation test is positive, then you will have to write, and some questions may be asked. Similarly, many skills which you have learned, um, almost 20 skills in your logbook, which we have also discussed in our classes in almost all the batches, and are present in the YouTube channel. In the torch eye examination, which I have been uh, and our department has been uh, letting you go through it, and in that almost all the skills are covered, and visual acuity with pinhole, regurgitation test, all these things, digital tonometry, these are covered. The recorded videos are present at the YouTube channel. I will share its link also. And we have also been re-streaming the pre-recorded videos in the last couple of weeks, but nowadays I am getting some problem of re-streaming software, so I've not been able to re-stream some particular pre-recorded video. So for that matter, you may go to the channel and check the your videos when you come in the ward and we performed. They are still there. And the third type of stations are observed and interactive. In these are the stations in which uh, just like observed stations, you would be asked to perform certain skill, like perform the confrontation method of checking the visual field on the particular patient which will be sitting in front of you. And the examiner will not only be observing you, but he will interact you, and he will ask you some particular questions about that skill, or he may move you will try to move you out of that topic to other topics, to let to know how much you know about glaucoma if you are performing the visual fields, and things like that. These are a few examples. I hope most of you already know it. I just wanted to remind you, and if you people have got any ambiguity or any issues, you are most welcome to ask any one of us and all the platforms, and hope to see you soon in some new video with some new topics. And I hope that this information would be of some information for the medical students of MBBS fourth year who are going in the annual examination. If you have any questions or comments, please write in the comments box without hesitation what sort of uh, guidance or help which at my level I can provide to my students, and to any student from anywhere. Uh, he is most welcome. For now, thank you very much. Allah Hafiz.